Hey everybody, this is Carolyn Becker. She's going to talk to you about what she does. Just let you know that I have my mask on because I'm here at school and Carolyn is not at school. She's at home, so she doesn't have to wear her mask. Carolyn, thank you so much, and the show is yours.
Thank you. So my name is Carolyn Becker. I am a parent of a senior at Creek, but I'm also a nurse practitioner, and I specifically do oncology nurse practitioner, which is a very specialized field. And so I want to talk to you about nursing in general, and then my role as an oncology nurse practitioner, which is an advanced role, and see if anyone has any interest or questions about what I do. So first of all, I wanted to talk about sort of my career path. In high school, I was really interested in science. I didn't have any interest in business or any English or anything like that. I really liked science. So I knew through high school that this is what I wanted to do. I wanted to do something in the medical field. So I was able to choose my path as far as the classes that I took for in preparation to go to nursing school. So two of the things that I felt were really important was I took AP Anatomy, and then I also took chemistry. I am not really good in math, and if you go now to nursing school, they talk a lot about math and how important that is. Back when I was in school, it was a little bit different. I got to sort of choose a little bit more what I wanted to do and how what I had to take. There weren't as many state requirements. So I was able not to take a lot of math, but that is not the path that they would recommend now if you were wanting to go to nursing school. So that's why I don't have math up there. So college. So when you get ready to pick a college and you want to go to school, I really want to stress that choose the college that's right for you. For nursing school, I will say that a nursing degree is a nursing degree is a nursing degree. You do not need to go to what is considered the top nursing school, go to an expensive nursing school. Never once in any of the positions that I have had have I been asked what nursing school I went to. So with nursing school, you finish nursing school and then you take boards, state boards for whatever state you're in, and you pass the boards, you're a nurse. That's what they care about, is that you passed boards and you have your license. They don't care that you went to Duke Nursing School, which is one of the best nursing schools in the state, unless your goal is to become an educator, go on and do like a PhD in nursing. That makes a little bit of a difference. But if you think I want to do, be a nurse and this is what I want to do, you really don't need to choose a school that is out of reach, unless that's, like I said, the college that's right for you. Be aware that when you do go to nursing school, you're going to have to take extra coursework. You're going to have to do labs and clinicals. It does limit how much outside work you can also do if you feel like you need to work during college or do other things. You are a little bit limited just by the amount of extra time that nursing school requires. And it does require a lot. And a lot of it is built into your credits, but a lot of it is practice and going to the labs and practicing skills and doing that sort of thing that take a lot of extra time. Not, it's not all just reading and writing and interpreting and like you would do more of in a business school. For graduate school, I was a nurse for 5 years before I applied to graduate school. Some of that was I moved and I needed to get residency in the state that I moved to, which was actually Colorado. And some of it was, I feel like it's really, really important that you have work experience before you go on to graduate school for nursing. Now, graduate school for nursing, they didn't used to require that you had work experience. You could go right from getting your bachelor's degree in nursing to going right to graduate school. A lot of programs do not allow that anymore because they feel that it is important that you get that work experience, that you learn how to do time management, that you learn how to do critical thinking, that you move beyond the hierarchy of, just doing task-oriented things and actually start critical thinking and implementing. Okay, so I have a patient that did this. I'm not just going to do this. I'm going to do A, B, C, and D before I call the physician. Or when I call a physician, I'm going to already know A, B, C, and D because I have those critical thinking skills that I didn't have. That's really, really important as a nurse practitioner when you're the one making a lot of decisions. So I feel like having some work experience is vital before going. And like I said, a lot of schools do not even allow you to go or apply to their school unless you have some experience. Now in the nurse practitioner program, it's changed a lot. I've been a nurse for 24 years, and I've been a nurse practitioner for 18 years. And obviously in that time, a lot has changed. I did have online classes when I went to NP school, so I was able to work. It was just really the start of that. I did my pharmacology online, statistics I did online, so a lot of that. So definitely you can work while you're going to school. I worked almost full time while I was in graduate school. It took me about 2.5 years to finish, which wasn't bad considering I worked full time. But that is because a lot of the classes were online, but you still have to do clinicals, just like you do for your undergraduate, for your bachelor's degree. So you have to plan for, getting blocks of time and clinical time in addition to the classwork. So that again is a little bit of a challenge, but because nursing is so flexible, definitely doable. And I would find a nurse practitioner program that has what you want at the time. So my nurse practitioner program was University of Colorado, which all the health sciences stuff for the University of Colorado, the pharmacy school, physical therapy, nursing, you do your prereqs up in Boulder, but then everything else is back down in Denver. So you really don't spend 4 years up in Boulder if you're doing your undergrad. I never set foot in Boulder. I did my graduate degree. I have a degree from University of Colorado, and I never set foot in Boulder once to go to school. So I don't really have this huge affiliation with CU or this, big connection to CU in Boulder like you would for undergrad that you actually lived up there. I went there, or I chose to do that. I could have done online programs because at the time they had an oncology specialized program. I have never been anything but an oncology nurse. I started as an oncology nurse right from the second that I graduated. Actually, before I even graduated, I was working on that floor from nursing school, and they offered me a position right from there. So I've never done anything different. And CU had an oncology specialized nurse practitioner program, which they don't have anymore, but they did at the time. So that was a really good fit for me because I knew at that point, being oncology for 5 years, that I didn't want to do anything else. I didn't want to be a nurse practitioner and take care of babies. I didn't want to help women deliver babies. I didn't want to do, senior care. I really wanted to stay in oncology. So I chose a program that would allow me to do that. But now there's a lot of online programs, so you can live here and find a program that fits and do almost all of it online. And then, you do your clinicals here. You basically set it up yourself. So that's sort of the career path that I chose and how I ended up where I'm at. So why do I think that I think nursing is a great profession. I love my job. I chose my field because I really had an interest in nursing, the school, how it fit with everything else. I knew I wanted to get married. I knew I wanted a family. Nursing allows that. Nursing, you get a really flexible schedule. I have never worked more than 3 days a week. The time that I've worked has been, I've done everything from 8 hours and just cut back to 24 hours. And then I've done 10-hour days, which is what I do now, 3 days, 10 hours, 3 days a week. And I've done 3 12s. But physically going to work, I've only ever done 3 days. Now, for flexible schedule, a lot of nursing, if you're doing hospital nursing, which is what I started with, then you are doing some nights and weekends. But if you're doing nights and weekends, you can do things during the week. You can schedule yourself so that you do your 3 days right in a row at the beginning of the week, and then do it at the end of the next week, and take 10 days vacation and not take a single vacation day, because you've still done your 3 days at the beginning of the week and the end of the week. So a lot of nursing allows for that flexible schedule where you can do other things, you can take vacations, raise your family. That was really important to me, and it allowed me to do that continually. And so I think that's one of the great things about nursing. The other thing is that the setting, where I have setting there. So you can actually, for nursing, you can choose what area interests you. I chose oncology. I sort of fell into doing oncology. I didn't really choose it. I sort of fell into it. I had someone that I knew that was the manager of the oncology unit. And when I was in nursing school, he's like, hey, do you want to come be an aide on my unit? And I was like, yes, that's perfect. And I stayed. I never wanted to do anything else. I don't think I'll ever do anything else, but that doesn't mean that I couldn't switch if I wanted to. And if someone else went into nursing and they wanted to try different fields, that is definitely an option. While I have been oncology, I've done different roles in oncology. I first started as a bone marrow transplant nurse, and I loved that. And when I decided to go to grad school, that was a little bit harder to do 12-hour shifts, even 3 12s. So to allow some flexibility, they had a position as the educator for both the bone marrow transplant unit and the oncology unit. So I took more of a management administration role and did the nurse educator role. That was great through school because that did allow me to sort of set my schedule and be flexible. I could do some stuff at home. So that was really nice. And then when I went into clinicals for grad school, I decided to get an even more flexible job, and I decided to take a 3-day-a-week position as a cancer research nurse. So all of this time, I'm still working within cancer, but I've been able to take different roles that allowed me to meet my other life goals at the same time. So that you can't do that with a lot of professions, but you can with nursing. So then I switched to the clinical research nurse, and then I graduated, and for 8 years, I was a bone marrow transplant nurse practitioner. And I loved that job, but I had to work nights and weekends, holidays. I had to do some call work. And as my daughter got older, as I mentioned, she's a senior at Creek. As she got older and I started missing sports things and events, that just became a little less appealing to me. And so I changed to my current position, which is as an oncology nurse practitioner at Porter Hospital in South Denver. And my role there is primarily in an outpatient clinic. So it's very much more of an 8 to 5, sometimes 6, depending on how busy I am. But it is much more manageable and allowed me to have weekends off, allowed me to leave early sometimes if I needed to get to something for my daughter, a tennis match or anything, then that helped. So there again is the flexibility that you can have with this type of profession. And so that worked for me. So my current role, as I mentioned, I'm an oncology nurse practitioner. So primarily what I do is I support cancer patients through their treatment. So I would say 90% of the patients that I see currently have cancer, are being treated for cancer. Some of them we've seen for cancer and we're following up, monitoring them, because we'll monitor them for 5 years at a minimum, and sometimes even more. So as patients are going through treatment, I help with their symptoms. All of you probably have someone that you know that's been touched by cancer in your family or your community, and you know that one of the symptoms is nausea. So a lot of what I do is what we call symptom management, which is patients come in and they are doing chemotherapy, and I say, how are you feeling today? What is the problem? They tell me, oh, I have nausea, and then we work through that. And I help manage that symptom. The goal always is to help manage the symptoms so that a patient has good quality of life, but is able to maintain their treatment so that we can continue to fight their cancer. So that's really important. Obviously, typically, pre-COVID, there was a lot of families with our patients. We, as everybody else, have had to limit visitors, but a huge part of my job is family support, supporting the family so that they can support the patient through their treatment. So it really is a community approach, which is another thing that I really like about this field in particular. In oncology, you build relationships, both with the patient and the family, their extended family. I have patients that I have one gentleman that I see that he is on his 354 treatment. Every time he hits 100, we do a party for him. One year we did, for 200, we did a cake, and he was doing shots in his tummy for his cancer treatment. And so we made a cake and we put a bunch of candles, or instead of candles, we put syringes on the top to commemorate 200 treatments. So 354 treatments, he comes in once a week. So that's years and years. I've watched his children grow up. We have kids that are the same age. We talk about college. So you really, in oncology, are in a special position where you really get to develop a relationship with patients, much more so than if you're working on a cardiac unit where those patients come in and, you know, they have a heart issue and they're there for a few days and then they leave and you may never see them again. That is not my position. So if you're a person who wants more of that sort of fast-paced excitement, then cardiac might be for you, or the ICU, or the emergency room. I really like building relationships with patients and their families. I think people are really fascinating, and I get to learn more of their stories in my role probably than I would in the emergency room. It's not quite as exciting as the ER, and I've done clinicals in the ER, and I've spent time down there, and there's lots of fun stories in the ER and lots of crazy stuff that you've seen, but you know, they're in and out. You don't really get to build a relationship. So, but you know, whatever interests people, they're able to find that. I coordinate care for the oncology patient. Unfortunately, we don't just treat cancer. Patients come in with, you know, high blood pressure, and, you know, sometimes that's affected by their cancer treatment. So I coordinate the care, sometimes with their primary care, sometimes with other disciplines, sometimes with physical therapy. So I'm really working with a whole community of healthcare providers, and I get to see what other healthcare providers do because of my role in coordinating that care. The physicians that I work with, I consider one of them I have worked with for almost 9 years, and we know each other. Again, we've watched our kids grow up, and he values my opinion. He's learned to trust me because he knows that I know what I'm doing after all this time. And so I really collaborate with the physician. I don't feel like they're my boss. I don't feel subservient to them. I respect what they do. They respect what I do. And sometimes they'll come into my office and they're like, hey, what do you think about this? And I think that's really great that I'm able to have such an important role in helping the patient. And I love learning from them, and I love collaborating with them and taking that responsibility. Within our clinic, I am considered one of the leadership because I have that advanced role. So when there's problems with patients, or as there sometimes is, or family members, or problems with the way the clinics run, I am sort of the middleman between the physicians and the nurses, and say, hey, this really isn't working. I've done a lot with the COVID stuff and how we should screen patients and how we should schedule patients, and how do we fit the same amount of patients in the same room while social distancing, and how can we rearrange things, and how can we move our schedule around? Can we extend our hours? I've worked a lot with the nurse in the clinic, the management at Porter, and how to do that. For a little while, I was screening for COVID and sort of helping set up some of the COVID stuff, and teaching the nurses like what they needed to do and what precautions we need to do. So not only am I taking care of patients, but I'm also considered a leader in our clinic, and make sure that, you know, if everyone else is supported, then the ultimate goal is that the patients are supported. And then I also provide education in nursing and other disciplines, in new treatments, different ways to do treatment, sometimes just refresher in different diseases that we treat. So the nurses will ask, like, I forgot about what this lab means, and patients ask the nurses this, and they're like, they come to me and they're, hey, we think this is what this means, but is this really what it means? So I'm considered an educator on there. So I have a lot of different roles. I support the patients, I support the family members, I work with the other disciplines, including the physicians, the nurses, a little bit of a leadership role, and that's all within, you know, under the nurse practitioner discipline. Now, even as a nurse, I felt like I had some of that because I did sort of move up the management track, and I was a charge nurse, meaning that I was the one that people went to when there were problems. So if you're that type of person that you want to be in charge and you want to work with other people, then, you know, moving on beyond nursing might be something for you. But not everybody wants to do that. I have really, really good friends, a friend that I went to nursing school with, that she is perfectly happy working on the cardiac unit as a floor nurse. She had never had a desire to go further on in school. She doesn't want to do anything else other than what she's doing. And I think that's great. And I loved floor nursing. I just felt like I wanted to be a little bit more involved and help the patients in a different way than floor nursing. So, but again, with nursing, you have that choice to do that. So what type of cancers do I deal with? So my daughter told me I had to put pictures for you guys because, you know, oncology nursing isn't super exciting. I don't have a ton of like really exciting stories. A lot of what I do is sad, but I love helping people, and we do have a lot of success stories, and a lot of cancers are, the survival rates are improving. And so that is really exciting, but a lot of what I do is a lot of talking and, you know, a lot of thinking and looking at things. So that can be not as exciting. So I want to talk just a little bit about a couple of things. The one on the bottom left, that is a melanoma. So I don't know if people know that Colorado has the second highest rate of melanoma. Third, excuse me, we're third now. The highest one is New Zealand because of their position near the equator, then Arizona, and then us. So, and that is because of our altitude. We are such a high outdoor physical activity state, and apparently we're not great about wearing sunscreen. So that is a melanoma. What I want to point out there is everybody, especially, you can sort of see this person's a little bit freckly, and everybody should be doing skin checks, even at a young age. I had a kid, he was 18, from out on the sort of the eastern plains, sort of the border of Colorado and Kansas, who had grown up helping, he was a migrant worker, and he had grown up helping harvest crops. And he had, and playing baseball, and he had a melanoma on the top of his head. He was 18 years old. So, and it had spread down through his scalp. So please don't think that you're too young to have melanoma. You should be doing skin checks. If you have any, obviously this looks really abnormal, but this is a melanoma. It can be dark. It can be irregular. One side doesn't necessarily look like the other. They can sort of flake off and bleed a little bit, but then come back, maybe get a little bit bigger. And melanoma can go into places where maybe never see the sun. I've seen melanoma under a toenail. And, you know, we don't get sunburned under our toenails. So just anything that looks abnormal, just always feel okay to get it checked out. The middle picture, that actually, I don't know if you can tell, that's a tongue. So in my practice, we do a lot of head and neck cancers. And a lot of head and neck cancers are caused by two things, smoking, and a form of herpes virus, for which there is a vaccine available if you've gotten that. And so this, I don't know what this was caused by, but this is cancer of the tongue. So this is my plug for please don't chew, don't smoke, and you don't want to have cancer of your tongue. That's a big enough area that that person probably had to have that whole area resected along with the bottom and half of their tongue taken out, which then affects your speaking and your eating. And you lose a lot of taste buds. So eating's affected by the mechanical, it's difficult to eat, and also because you don't taste much and you don't want to eat as much. It sort of ruins that. So that is a tongue cancer. And then this bottom, the lump under this gentleman's ear, this is a salivary gland cancer. And this is another one that was caused most likely by smoking or chewing. And not just smoking cigarettes, but we do know that depending on how it's mixed, the vaping and marijuana smoking might have funguses in it or chemicals that you don't know about, and they're thinking that there may be a correlation to head and neck cancers from that also. So, so I put some of these pictures in there, and as far as other, you know, screening, those are probably like the big ones as far as preventative is smoking, and then just doing sunscreen and skin checks as far as trying to prevent cancer when you're young. Anytime, and I know my daughter with the news this weekend, the movie star that died the colon cancer. She wanted me to put something about colon cancer to be timely as far as screening for it. And there really is no early screening for colon cancer. And she asked me about that and thought it would be interesting. And there is no early screening. It's just, please know your family history. And if you are high risk, then you start doing colonoscopies or screening earlier. I think the big thing is just to know your family history and know what's in your family history so that you can take appropriate measures earlier in life or even later on in life and monitor what you need to do. So in addition to, being an oncology nurse, I'm really involved with the Oncology Nursing Society, which is local and does a lot with screening and prevention and detection. And so that is another interest of mine in trying to decrease the number of people with various cancers that can be prevented. So that is what I do. And I hope that some of you, since you're in Mr. Stirrup's class with the health professions, have an interest in nursing. If you have any questions, please, I think there's a mechanism by which he's going to be doing that. Please, you can get information from him on how to contact me or through him, do questions. I'm more than happy to answer any questions. I used to be able to, pre-COVID, let students come and sort of shadow and see and do a little tour. But with COVID right now, we don't even have the volunteers like we used to, so we really can't do that. So I can't offer that. But I hope that you found this interesting and that this further made you, further interested in the healthcare profession. Thank you.
Great job. Thank you so much. I'm going to go ahead and hit stop, but it doesn't stop our Zoom meeting.